Hello, everyone. We are honored to talk with you today about our project, Breaking Silences in the Model Minority, a national intervention to increase mental health awareness and decrease stigma in Asian immigrant families. Although Asian American youth are often stereotyped as a model minority, they are at high risk for depression and suicide, and among the least likely of all racial groups to utilize mental health services. Many Asian American youth are raised in cultures that emphasize saving face and downplaying emotional suffering. And Asian immigrant parents often have limited mental health literacy and skills to communicate effectively with their American born children. Parents face additional challenges, including language barriers, lack of mental health awareness, and stigma of mental health issues and treatment. To address this need, our Breaking Silences team has been working to build a culturally sensitive, community co-developed bilingual mental health curriculum focused on youth mental health for Chinese immigrant parents. Through our project, we aim to empower our community to decrease mental health stigma, improve mental health literacy, improve parent-child communication, and increase help-seeking behavior.
Year one of our project has involved a multi-pronged approach of national community outreach and engagement to better understand our community's needs and priorities, build capacity and trust, and identify key barriers contributing to the silence around mental health issues in families. Highlights of our work include a community mental health webinar series, including over 24 webinars over the last year and a half, reaching 3,000 plus participants from 50 states and other countries. Parent surveys in a more in-depth bilingual parent focus group. Formation of our UC WAVE Youth Ambassadors program focused on leadership development, peer support, and serving as an advocacy group to our project. Our UCA Parent Ambassadors program, our community culturally adapted mental health first aid training, and our Let's Talk mental health conferences focusing on the mental health needs of Asian American youth, and this year reaching over 1,000 community members and 700 educational and mental health professionals nationwide. These initiatives have helped our team to strengthen our community relationships, gain a more nuanced understanding of our parent community's needs, and identify our team's specific targets for intervention.
Using data gathered from our community work, we have developed our Breaking Silences bilingual educational toolkit, the core of which is a full-week curriculum covering youth voices, stress and mental health, parent-child communication, and psychological resilience. Curriculum development has been informed by the ADKAR model of change and incorporates the 5 domains critical for learning: awareness, desire, knowledge, ability, and reinforcement. Working with our UCA youth ambassadors, our team has developed a curriculum that highlights youth narratives related to mental health, racial identity, and parent-child relationships, as well as stressors and risk factors specific to AAPI youth. The curriculum provides education related to common communication challenges and teaches more effective strategies parents can utilize to communicate with their children. Lastly, it teaches about the importance of resilience and how parents can support resilience building in AAPI youth. The curriculum includes a facilitator guide such that the toolkit can be used easily by community groups and support individual parent use for self-learning.
This summer, our team will lead a feasibility study to inform curriculum improvements. And this fall, we plan to run a larger pilot effectiveness mixed method study, including 35 to 40 Chinese immigrant parents. The objectives will be to further measure toolkit curriculum effectiveness, utilizing standardized surveys to assess various constructs, including mental health stigma and literacy, family communication, and parents' help-seeking attitudes for children's mental health. Next year, we aim to further refine our curriculum and officially launch our website and expanded toolkit program, including videos and associated educational resources. Our team's aim is to have the toolkit be usable directly by community groups and individual parents in both Chinese and English to support access and education of our larger community, as well as sustainability and scalability of our program. Our longer-term goal is to adapt the toolkit into other languages for use within other Asian minority communities, with future evaluation of program reach and effectiveness.
In closing, we'd like to acknowledge the incredible support we've received from RWJF and clinical scholars. Developing this project in collaboration with our community has truly been a humbling experience in the context of increased anti-Asian racism and violence this last year and a half. and we look forward to continuing our work to make a positive impact within our community. Thank you.